Are you a chiropractor with a struggling practice, having a hard time finding and keeping patients? Is your staff falling short of expectations? I'm Dr. Scott Sawyer, and DC Trainings has the answers that you need. So tune in now and find out how. Hello, everybody. Welcome to DC Trainings. I'm Dr. Scott Sawyer, and it's great to be with you today. I'm actually really happy about this topic because it's something that happens every day in my practice, and hopefully every day in yours as well. And this topic today is week 2 of module 3. So what is module 3? Module 3 is our report of findings module. Week 2 is called Greet Patient and Spouse. And so, again, the reason why this is so near and dear is because, just to frame this, when your new patient comes in and they experience your office on their first visit, right? And by experience, I mean experience, right? This is an experience for the new patient, usually completely different than any other doctor's office they've been to, first of all, because doctor's offices in the mainstream medicine environment are quite different. But secondly, they're being introduced to chiropractic care, maybe not for the first time if they've been to a chiropractor before, but they are being introduced to your office for the first time as a new patient. And so going into that process of learning about chiropractic and experiencing your office and your style of chiropractic and your team and meeting everybody on the team, or maybe not everybody, but most people, most of the team, that's an experience for them. And when they leave that from that appointment and having that first experience, that memorable welcome, as we call it in DC trainings, they leave the office and they go home and they plan for the next visit. And it's based on those impressions and those feelings and that new awareness. So when they come back to the next appointment, we want to make sure that we continue that momentum, which we talked about in the last webinar last week, in terms of beginning the report of findings. Today, we're going to jump into the next step of that process, which is to greet the patient and the spouse. And I think this is probably a good time just to jump right into our PowerPoint so I can show you exactly how this flow works and really emphasize some of the important parts. Because in the important parts of this is hopefully the opportunity that the spouse is now here with your new patient. And when the new patient came the first time, most likely the spouse wasn't there. So there's this additional person that's involved in the equation. And of course, I would never advise you to do anything like a bait and switch. Tell them to bring the spouse to discuss financial matters, or tell them to bring their spouse because you're not going to accept them as a patient if they don't. That kind of approach is outdated. I know maybe in the past, some coaches have talked about that, but here we want to invite the spouse for participation in the patient's recovery process, in the chiropractic care that they're going to be receiving, in the process and the sequence that we're going to set up for them. So we want to make sure that the spouse is involved in that process so that they can assist with this. That's why I said I wouldn't ask you to do a bait and switch. There actually is a very important reason why the spouse is here with the patient. And we'll get into that, and I'll share that with you as we work through this module. But that's why this section is entitled Greet the Patient and the Spouse, both of them. And when the spouse comes, I have to say, I mean, it makes me smile just thinking about it, because when the spouse comes to the report of findings, this is an opportunity for you to share our vision, our message, our philosophy, our unique style of healthcare with a brand new person, in addition to the patient who already had a great first impression on their last visit. So when we go through this, I want you to be able to see that and experience that, and then continue using that so that your new patients and their spouses can experience it as well. So let's dive into this, because where we left off, the doctor did this greeting, right? The doctor and the CA. And I know there's a couple of CAs on the call today. I'll just say hello to Celeste. I know you are experienced with report of findings and delivering reports of findings with Dr. Knitsch. So in this experience that we're having with our CA coming into the office, right? Or sorry, into the room to deliver the report of findings, it goes from a position where the patient came in and they're there with their spouse to all of a sudden there's potentially 4 people in the room. So we don't want to be that, we don't want to make that overwhelming. We want it to be welcoming and comfortable. So when I walk in the room, the first thing I do is I want to greet the spouse. Hi, Mike, the spouse, right? Hi, Mike. It's great to meet you. Thank you so much for coming today. And then I turn to the patient. Hi, Mary. It's great to see you again. And both of these introductions have a very caring handshake. Hi, John. It's great to meet you. Or Mike, it's great to meet you. And Mary, thank you so much for bringing Mike with you because we're going to go over some important information today. So that's that greeting. Now, I also want to introduce my CA because, as I said, there's now 4 people in the room potentially, and we don't want that to be a shocker, right? So, real quickly, I'll say, by the way, I just want to let you know that my assistant, Brenda, is here with me, and she and I just went through your file. She has a lot of experience in this area. So she's going to be going over the information and sharing the results with you. I'll step out for a minute and then I'll come back and we'll, of course, get started with your care or answer any questions that you have, right? So on the screen, you see this introduction or introduce CA if necessary. Well, hopefully, you and your team are doing reports of findings together. And so you'll always be introducing the CA, right? So that's why I say if necessary, because sometimes there's doctors that are just doing the report of findings completely, and that's okay. But we want you to be able to grow into the level of having them join you and have your CAs participate in this. So we want to introduce our CA, and then from there, I'm sorry, and there's a couple of components to that, which I just kind of glossed right over in telling you first. So the first one is sincere eye contact, right? Hi, Mike. It's so great to meet you. Thank you for being here today. It's important that you're here. Hi, Mary. Welcome back. It's great to see you. And I'm really looking forward to going over the information and the results from your initial exam. Boom. Okay. There's a caring handshake, which means we have our palm up on the handshake. It's called a caring handshake instead of a more business handshake. And my CA and your CAs want to just choose a seat closest to the patient. So when we walk in, we want to have the chairs and the floor arranged in a way so that the stage is set and the CA can just kind of slide right into position to be able to, take over and go forward from there. So that happens while I'm doing the introduction. My CA's taking a seat, I'm doing the introduction, and then usually I'll sit, because we have an adjusting table in this room, and here's a picture of the layout. I'll sit on the adjusting table because I'm not going to be there for long, right? For doctors who are doing the report of findings entirely, obviously you would walk in and sit in the chair that is the one where you're going to give the report of findings, and that's fine too. But I wanted to show this picture because this is my CA in the blue jacket, and then my patient and her husband. I'll say Brenda's the patient, and then her husband is sitting next to her. So they have their seats arranged, and we have this sort of, closer circle because we're going to be going over some private information, right? Some health information. So we want to have this in this type of an environment, not sitting across from a desk or across the room, more of an intimate kind of setting because we want to talk about the results of the exam, which is a more personal topic to be talking about. Okay, so once we do that and we have that introduction done, then the doctor begins the report of findings. So even though the CA is going to deliver the report of findings, the doctor is going to begin the report of findings. And it says on the screen, subluxation details and being Socratic. So what do I mean by Socratic? What I mean by that is to ask the patient to repeat the name of the condition that we're going to be taking care of them for, right? Now, part of this leads right into a conversation with the spouse, but this is an important place to start. So how would this look? The way this looks is when I come in and I do that greeting, then I'm sitting on the table and I say to the patient, Mary, I just wanted to recap a bit to bring Mike up to speed. We found a certain condition in your spine, and that condition, in my opinion, is what's causing these health challenges that you're having and that you shared with us. Now, just so I'm not too redundant, do you remember the name of that condition from your last appointment? Now, I want you to write that down, excuse me, in your notes, because when I say, just so I'm not redundant or not too redundant, what's the name of that condition? See what that, by prefacing it in that way, you don't want to come across being insulting. Like, what am I in first grade here? You're giving me a quiz right out of the gates? No, just so I'm not too redundant. Now, if they say, what's a subluxation, right? Okay, great. Now I know that you know what we're talking about, and I don't have to go back over it again. And if there was a patient who kind of got defensive about that, which has happened, it doesn't happen very often, but it may, then I would just remind them there's many patients that don't know what that word means. It's kind of an unusual term in healthcare. So I just want to make sure that, if you had any questions about it, we could recap on that. Obviously you don't, and that's fine. Let's move forward, right? So that's a nice little phrase to be able to use even in your conversations with patients over table talk. Just so because I know we covered this before, but do you remember the name of that condition? Yeah, it's a subluxation, doc. Okay, perfect. Yes. Okay, so what I wanted to say about a subluxation is, see, it's just a nice way to preface that. So that's what I mean when I say, let's be Socratic in our subluxation details, right? So we're about to begin those subluxation details, right? So how do we do that? We talk about the subluxation, we ask them to repeat the name, and then there was a secondary condition where we left off on the first visit that we were concerned about, and that's the aspect of degeneration, right? The degeneration is what a subluxation leads to if it's not corrected. So the objective always is to catch the subluxation as early as possible before there's permanent damage in the spine. And so we want to make sure that they have an awareness of that, because that creates urgency in the mind of your patient to make sure they stop that process from carrying forward, right? A great analogy would be if I said, as a dentist, if I was talking to a patient as a dentist, and I said, I found a small cavity, it's in your tooth. And what we do know about cavities, yours is small enough right now, I can actually just polish your tooth real well, and it should just seal right up and you're good to go. But what we do know about cavities is if they're left to run their course without being stopped early, like in the case of where we found yours, then obviously they would lead to decay and degeneration and this tooth decay issue, which can become a much bigger issue down the road. Just telling you that because while you're here today, we could just polish the tooth up and take care of that cavity early. See, that's perfectly reasonable and actually desired by a patient in a dental setting. Yeah, tell me what I need to do, doc, to prevent this from getting worse and causing bigger problems later. Don't be afraid to use the same analogies or the same examples or the same education when it comes to a subluxation, because we know that a subluxation, if it's left to run its course, will cause degeneration of the spine. And that's another term for osteoarthritis. And so it's actually our job as a doctor, as a teacher, to educate our patients about that process that could be coming up if they don't act now to prevent it. So that's, again, important from the standpoint of using that subluxation education and being Socratic about it. So you're setting the stage. Now, what this leads into, though, okay, so anyways, got that right there, right? So we're going to use the subluxation details. We're going to ask questions. We're going to be Socratic about it. And then from there, we're going to go to confirming what we found on the last appointment and talking about what we've discovered after the new patient's first appointment when we reviewed all of the findings. And what was that? That was the concern about degenerative joint disease, DJD. See, when we do a palpation type of spinal exam or a palpation type of exam for a patient, we don't know for sure if there's degeneration. We don't know if we actually, we can't confirm that, or it's called a confirmatory diagnosis. We don't know for certain if that's exactly what it is. But once we get our tests back, I know many of us take x-rays or we do different types of diagnostic testing that will confirm whether or not there's degeneration. Once we know that, then we need to be able to let them know. So how would that look in this case? What that would look like is, Mary, I want to just let you know, based on that subluxation. Oh, I'm sorry. And there's another step in here. Let me stick to the PowerPoint for just a second, and then I'll do a recap because that'll keep us on flow. There's another important step in this process. So we confirm the subluxations and we confirm whether or not degeneration is present, which we didn't have the answer to on the first visit, right? But now that we know, we want to confirm that. And we want to remind the spouse of what the chief complaint was, which is different in some cases, not always, but it's different from the primary concerns. So keep that in mind. We'll come back to that. So we remind them about the chief complaint, and then we obtain the spouse's impressions of chiropractic. So again, this is all part of that introduction that's done by the doctor for the report of findings. So, oops, actually, hang on, let's go back up. I want to go through this flow right here and just give you an example of how this works. So first of all, or I just basically demonstrate how this works. First of all, Mary, we did confirm subluxations at your last appointment, and we found those through your examination. What we were also concerned about was whether or not you had degeneration or degenerative joint disease, which is a process that comes from an uncorrected subluxation. So we did find, actually, we did confirm that you have degeneration associated with your subluxations on that first visit. So I want to let you know that today right off the bat, because that's important in terms of how we take care of you and how we stop the damage. Now, for the spouse, then I would turn to Mike in this case and remind him. Now, Mary, when she came in, she was concerned about her lower back. You're probably aware of that. It's been going on for about 10 years off and on. Yes, I'm aware of that. Perfect. Well, she shared that with us, and we actually, through the process of the examination, we found this condition that we're talking about called a subluxation. Have you ever heard that term before? And the spouse might say, yeah, I've heard it. I went to a chiropractor for years. Oh, okay, great. So they're familiar. Or they might say, nope, never heard that term before, which is usually the case. Usually they'll say, I haven't heard it before. That's your shoe-in to talk and ask about the spouse's impressions of chiropractic. Because remember, if a spouse comes in, much like with the new patient, and in their mind, they're thinking in the background some rumors that they've heard that chiropractic care causes strokes, or chiropractic care is so expensive, whatever those rumors were, that's going to be in their mind, and they're thinking about that with sort of an arm's length approach or acceptance of being in your office. So we want to make sure that we address those things so that they can put their mind at ease and know that that's not what we're going to do here, and we're not going to follow the same path in this office, right? So we want to obtain the spouse's opinions of chiropractic, and a nice way to shoe into that topic or that conversation is to ask if the spouse has actually heard this term subluxation, which their spouse just said, because you used Socratic style questioning. That's your shoe-in. So yeah, Mike says, yeah, I've heard of a subluxation before. I used to go to a chiropractor. Oh, great. Well, thankfully, they went to a chiropractor before, but even more thankfully, that chiropractor used our namesake term, subluxation, in the course of that person's care previously, right? So that would be great. Most of the time, they say, I haven't heard that. And then you would say, well, as it turns out, we actually have found this condition, and let me explain more about what that is, or we'll be going into detail about what that is. I'm not going to explain that. I just want to get the spouse's impressions of chiropractic handled and out of the way, so they're not going to be a barrier to entry when we explain the care plan for the patient, right? So we want to address those right now with the doctor. And now I want to just say, because for those of you who have been following along, you're probably saying right now, well, wait a minute. In the new patient consultation, my CA asked those questions. It wasn't the doctor. Well, in this case, because we built a rapport with the patient on the first visit, that's okay. The CAs can go through the impressions of chiropractic. In this case, because you have a spouse here, I recommend the doctor does it. And part of that is just to make sure that if they have any kind of harbored impressions, that we just get those out on the table, and they'll sort of relax and go, okay, perfect. I'm here. I understand now, and I feel better, right? So I like to get those out of the way right then and there. So once we've done that, then we're going to give the push off. Okay, so you follow that sequence. We use Socratic style questioning for the subluxation. We went into repeating the chief complaint, and we went through the positive and negative impressions of chiropractic, which we have a whole script for that in module 2 for you. You can pull that if you need to review that. Then I'm going to give the first push off. Now, this is important because this push off is going to be the first of a 3-part sequence. We have the push off, and then we have the demand for care, and then we have the clear 100. Those 3 steps are critically important during the report of findings process if you want to increase your conversion rates and increase your retention. Okay, so I'm going to say that again, because these 3 steps You have to nail these because you'll know long before the end of the report of findings if the patient is on the fence about starting care with you. You want to make sure that you maximize your retention and you want to maximize your conversion rates by using these 3 steps. This is the first of the 3. It's done by the doctor. And it goes like this. Now, Mary, I just want to let you know that based on the subluxations and based on the degeneration, it's going to take some more time to correct your condition. And so I want to make sure that if I take you on as a patient, that you're willing to follow through with my recommendations, or that you're able to follow through with my recommendations, because if you're not, your results will suffer. And obviously I'd rather not have you as a patient if you're not going to get results here. So in order for me to accept you as a patient, it's going to be really important that you're able to follow through with all my recommendations in order to get you the results that you need. And as I said before, stop the damage. Really important. So that, and then I stop. Now that's the push off. Okay. So let's go back to the screen here, because I'm doing that intentionally because I want to give the patient an opportunity to say, whoa, 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 I just came in for a Groupon coupon. I'm just here for my free adjustment, or, whatever it is. We want to give them a chance to respond to that first push off. And in the scripts, I'll show you there's ways to handle that. Okay. We get into that a little bit more in the financial arrangements module when we overcome objections, but that's a different topic for a different day. Well, we'll get into more detail later. But I'm going to give the first push off. Now, after I give that push off, then I'm free to go. I can go see other patients and my CA can continue the report of findings. So that process is about 5 minutes. Now, it could be a little less, it could be a little more, depending on what comes up in that conversation, but that process follows that flow. Okay, so in the live seminar, of course, we would now take some time to practice, but what I want to do is I want to jump over to the website and show you these scripts and this flow. And I do want to just say, as kind of a special announcement, and I see Dr. Knitsch, you're on the call. Thank you so much this morning, by the way, for the messages and the back and forth and the pictures. Awesome pictures, awesome information. So yeah, thank you. I just wanted to recognize that. I certainly appreciate you and all that you stand for and your input. So thanks for being on the call. But I think you'll really appreciate this, as will everybody on the call. We are getting ready to roll out our new version, I think it's 2.3 now, of DC trainings. So our new version of DC trainings is going to be rolling out over the weekend, which means next week, when you come to DC trainings, the website, you'll see a fresh look about it. There's a couple of little hiccups in there still, which hopefully by this weekend they'll be ironed out. It's no security threats or no instability or anything like that. There's just a couple of things that you'll notice that might look a little bit different, but we're really excited because the platform that we've moved over to is a much more stable platform, and it gives us more opportunity and flexibility as far as development and further enhancements to the website. So we have this new platform. I've been working on it for months now, literally. Since the end of last year, but we're finally ready to launch. And so I'm really excited about that coming up over the weekend. And when you log in next week, you'll see a little bit of a different look and a feel, but we'll be working on that this weekend. So in jumping into the materials here, because I want to go through these scripts, actually, let's do the outline first. So on your screen, you can see many doctors struggle with conversion rates, especially when asking for a commitment to follow through with an extended care plan. The patient may simply state at the end of the report of findings, I need to go home and talk to my spouse before starting care, right? We've all heard that at some point, which can be frustrating, especially when you give it your best and you want your patients to really get the best that they can out of their chiropractic care. So then this outline provides a simple solution, inviting a patient to bring their spouse to the report of findings so they can decide together. As a bonus, the spouse may also request a first appointment, right? Because they're here, they're experiencing what we're teaching our patient about how to take better care of their condition. So we want to follow these steps. So the first step is request the patient brings their spouse to the report of findings. And this is given to you, a specific way to ask for this is in the Conclude DC examination script, Module 2, Week 5. So that script is very important at the end of the first appointment. When the new patient is there with the doctor, that script is what you want to follow, and that will greatly improve the number of patients that come back with their spouse so that you get better retention, you get better conversion rates, and you'll even get more new patients from that. Okay, so that's really important right there. The second way to follow these steps, or second part of these, is to ensure that the patient brings their spouse. Now, what does that mean? The reason why we want to ensure that is because we can follow these steps, and then we start the process by saying you should bring your spouse, and there's reasons why. And of course, I'm paraphrasing that script. Then we want to ensure that they actually show up. And how do we do that? There's some specific steps here that will ensure that the spouse actually comes with the patient. First of all, the reception CA uses the new patient completion script. Use that script. It's gonna really dial in that this is not just an appointment for your patient. It's an appointment, for the patient and their spouse. It's a two-person appointment, so that when the patient walks into the report of findings, what you don't want to hear is a CA saying, "Well, where's your spouse? Oh, I forgot." Right? No, you want them to walk in and say, "You know what? I am so sorry. I'm here. I know my spouse was supposed to come and something came up," right? The bridge broke, the water's flooded, or whatever. But it should be something significant enough to where you followed the steps and your patient literally walks in saying right off the bat, "I'm so sorry. I'm here by myself." And they should be literally apologetic about it. If you follow these steps, that's what will happen sometimes. The rest of the time, they'll come with their spouse. Okay. So CAs, use that script when you're finishing the new patient appointment. And then follow up from there with a phone call or a text message the day before to confirm the new patient and the spouse, right? So you're using a two-step process. Well, it's actually a three-step. The first step is you let the patient know they need to bring their spouse, and here's why. Here's the reasons why. The second is you schedule the appointment for both people. So it's a two-person appointment. And third, you confirm the appointment again for both people, right? So they know that's what needs to happen. So then it gets into A here, which is that, great, the patient arrives with the spouse. We welcome the spouse by first name, thank them for coming, and begin the report of findings on time, right? This pattern, if you can start it on time, emphasizes the importance of the appointment and respects the spouse for making the time to be there, right? That's important. Now, if the patient, comes without the spouse, then we have a couple more options. We can ask them politely to reschedule the appointment for when the spouse can attend. And if they can't do that, then you would continue the ROF with the spouse. But the first response in this scenario, and I want to emphasize this because CAs, you're in the driver's seat on this, right? The doctor's probably in the back seeing patients, and you're at the front desk, and here's this patient that just walked in for their report of findings. You're in the driver's seat on this. How you handle this situation is going to determine not only whether or not this patient starts care and comes back with their spouse, but it's also going to determine how they view the way you handle your appointments in your office. Would you like to have a 100% show ratio for your appointments? Would you like your patients to come in on time? Would you like them to arrive maybe even a couple minutes early? All of these things start on day one. This is where we're taking off the training wheels, and we're starting to let our patients know, okay, this is how you stay upright and move forward in our practice, right? So use these small steps to ensure that that process is clear and your expectations are made about how this patient should continue care with you. Now, the other option, if they're not going to reschedule, is to continue the report of findings using the report of findings outline. And I've given you that outline. That was in last week, so week 1. But stop before giving the recommendations or discussing financial arrangements, right? So this right here is a big point. You can do the whole report of findings with your patient. They're there, they came, they were on time, they're ready to go, all fantastic. And then when you go through you're explaining the subluxations, you're showing them how it's affecting their spine, and then you get to the point where you get your demand for care. So you go from the push off to the demand for care. And right when you get to the demand for care, and you can reference this on the outline, but you stop and you say, now, the doctor had made these recommendations with the assumption that your spouse was going to be with you today, and that there were going to be specific exercises to be incorporated with your care while he's taking care of you or she's taking care of you. Since your spouse is not here, we can't do those exercises. and therefore it's going to take longer to get you the results that you need. So we can either add the extra time for you to get results, or we can reschedule for when your spouse can be here, and that will shorten how fast you get better. Now, when you lay it out like that, of course, it's in the patient's best interest to have their spouse there and do the exercises and get better results and be more consistent, more compliant, more congruent with what you're recommending for that patient. So you can see how all these steps fall into each other, and they're all really important because they're building. And I'm not saying withhold the patient's adjustment. That's not what I'm saying. You can still adjust the patient, but you're probably going to schedule another report of findings for that spouse to come. So explain that the spouse is asked to attend so the doctor can explain exercises which can speed recovery and possibly reduce costs. Ask the patient if they are willing to reschedule the appointment for a time when their spouse can join them. Okay, so once we've done that, the patient either says yes or they say no. With their new understanding of the importance of correcting the subluxations, and they saw the severity now, right? They've seen their results. They know what's going on. Many patients will opt to reschedule and bring their spouse. Great. If not, continue through to the report of findings completion. Okay, so if they say, no, that's okay, my spouse is just not going to be able to make it. And this was years ago, but I've used this example in the seminars. I had a woman who was a new patient, and she said, my spouse won't be here. He's in jail. And I thought, well, okay, there's a trump card right there. I can't work around that one. That's fine. We'll just do your report of findings. So that may be what happens. Now, if this patient chooses to reschedule, it might be necessary to provide one or more pre-ROF visits until the spouse can attend. It also helps if all CAs are cross-trained to deliver report of findings to offer times that work for the spouse, right? Because it might be, and I'll use my own office as an example, it might be that the reason why the spouse isn't there is because you're offering report of findings at 10:30 in the morning or 2:30 in the afternoon, and the spouse happens to be working during those hours. Now, you may give the spouse a doctor's note to be excused from work to join your patient, and that's perfectly acceptable if that's what it comes to. Or you might choose to schedule another adjustment, like because one of our recommendations is going to be to see the patient at a certain frequency. So you could, without giving the whole care plan out yet, just say, well, let's go ahead and get started as the doctor recommended, without giving the whole care plan. You don't want to give that out yet. Remember, we're stopping the report of findings before recommendations and before financial arrangements. But you could say, let's schedule a couple of adjustments because if your spouse is going to get out of jail next week, I'm kidding, of course, then they'll be able to come with you next week, right? Or whatever the hangup is, you can schedule around that. And you might need a couple of appointments in the beginning to get past that threshold, and then the spouse can come. Okay, so if that's what's needed, great. And there's been lots of times where a patient said, my spouse is out of town this week. They won't be back till next week. And then we see them for a couple of adjustments and schedule the report of findings with the spouse next week. The spouse comes next week. They get started with their care. Everything's good. Okay, so just use that as a way to overcome that challenge. Now, there's a script to this. So up here we have the doctor in blue, the patient in red, and the spouse in green. So, hi, John, it's good to see you. Mary, thank you for coming too. At John's last appointment, he shared that he's had low back pain for about 2 years after a fall at home. Are you aware of this? Yes, I am. I've known about his pain, and I was there when he fell. John, it's a good thing we did your exam, as we found the most likely cause of your symptoms. There are misaligned vertebrae in your spine affecting your nervous system, and I'm concerned about their severity. Do you remember the name of the condition we found at your first visit? Yes, it's called a subluxation. That's correct, and it's causing many of your health problems. We also gave you information to read at home. Do you remember the name of the secondary condition? Yes, I read it. It's called spinal degeneration, and it's caused by uncorrected subluxations. That's right. Unfortunately, we also found evidence of this condition in your spine. And the patient says, I was afraid you were going to say that. And then now to the spouse, right? I guess I had it backwards before. Mary was the patient. In this case, Mary is the spouse, right? So, Mary, have you ever been to a chiropractor or heard of a spinal subluxation? No, I haven't. And then down here, I want to read these footnotes. I'm sorry. So the details at first only relate right here to the chief complaint, not the primary concerns. If there's a difference, if they're the same, it's fine. But if there's a difference, we're only bringing up the chief complaint because the spouse won't be aware oftentimes of all the primary concerns or how they relate to this visit, this appointment. This process also reveals how well the CA or DC educated the patient on their first visit. So that was footnote number 2, which was right here, right? It's called a subluxation. So what does that mean? In footnote number 2, we want to know that on the first visit, on the patient's first visit, we did our job about educating them about subluxations and about chiropractic care. So if we did our job correctly, they'll know what that is. And fast forward to this appointment, they'll be able to tell us that they remember what that is. And then number 3, as I said, whoops, I scrolled past it right here. Have you been to a chiropractor or heard of a spinal subluxation? And then footnote 3 says, ask for the spouse's impressions of chiropractic using the opinions about chiropractic script. So that's from module 2, same script, different scenario. Now we're incorporating that script with the spouse, not with the patient, because we already did it with the patient. Now we're incorporating it with the spouse. And here's an interesting thing that'll come up, and this happens often enough to where I want to share it with you. There's many times where the same concern that the patient had when they came in, say it's strokes or whatever, is the same concern that the spouse is going to bring up right now. So what does that tell you? That tells you they're talking about it, which is good. It's very good because we want to make sure that it's all an open book. We know what's going on here. Another thing that they'll probably have talked about is the subluxation. So oftentimes when we fast forward to the second visit and the spouse is there and I say, this condition is what we found in Mary. Have you heard of this condition before? And the spouse right away will say, oh yeah, she told me about it at home the other night, right? So there's this conversation that's happening. And why is that a good thing? Because it's building an awareness. It's building an understanding about chiropractic care, and it's spreading through their family. They're all incorporating it through those conversations around the dinner table, through the conversations about their children, through the conversations they're having about how to get past this health challenge or even get healthier, right? This is becoming part of the conversation, and we want to test for that. We want to listen for clues that that's happening, because that's the transformation that happens when people understand chiropractic and the damage from subluxations. They start to talk about them and they start to be aware of those things. We want to make sure that we're testing, and that's why in the script, footnote number 2 says this process reveals how well the doctor or CA is educating the patient. We want to get feedback based on that. Okay, so let's keep going, because that was just a point that I wanted to share with you. Okay, so then the doctor, okay, John, these new findings have me concerned, and in order for me to accept you as a patient, it's only by knowing that you're committed to following my complete recommendations. If not, that's okay, but I would not be able to accept you as a patient knowing that your condition would continue to get worse. Now, what is that? That statement is called the push-off, and I shared that with you. That's footnote number 4. You want to make sure that you have that as part of the conversation. Very important. Then the patient says, well, that makes sense. I'm committed to doing whatever it takes, or doing what it takes to get this fixed right away, right? That means that through our first visit processes, they became educated, they're definitely concerned, they're eager to get started, and they feel like they're in the right place, right? So that's what that comment tells us about where their headspace is at. So then we're going to do our best to help you. First, my assistant will explain the details, and I'll return shortly to answer any questions and hopefully get started. In the meantime, you'll be in good hands with my assistant. Now, I want to just highlight or showcase this phrase right here. Hopefully, we'll get started. What does that mean? It means you're being true to your promise. Your promise was, I'm happy to accept you as a patient, but it's only with the understanding that you're able to follow through with my recommendations. If you're not, that's okay. It's your choice. You don't have to follow my recommendations. But if you're not willing to follow my recommendations, I'm not willing to accept you as a patient, because I already know that you'll be getting worse while I'm taking care of you. And I think neither one of us want that. So that's important. Even as you're leaving the room and you're leaving your patient in the good hands of your CA, by saying, we'll hopefully get started, you're letting the patient know that you are firm about your requirements in order to accept them as a patient, not the other way around, right? So very important. Then the patient says, okay, thank you. And then footnote 5, DC leaves the room to serve other patients, and CA continues with the report of findings. I'm not sure if I read that whole number 4. So this statement is called the push-off and adds an extra level of commitment from the patient. This will increase retention, leading to better overall results. So really important there. And then there's, of course, in our materials, there's a report of finding. Oops, we're a little bit lower here. Sorry. There's a demo of that. You can watch the video. There's also an intro. I like the demo. It's great because it goes through the specifics of how I do that push off with the CA, with the patient and their spouse, and my CA is there too. So you can check that out. And that brings us full circle with our topic today. And I did see a question that was typed in. Let's see, when is the next live in-person seminar? Great question. We're in module 3. The next live seminar is module 4. That'll be in July. And so for that seminar, that will be a live seminar. And I don't have the date on, actually, I do have the date. It's on our website. So let me tell you the date right now, and I can firm that up. But it is going to be, let's see, I'll go back to my screen here. There we go. So that's financial arrangements. It's July 13th. So that'll be our next live seminar coming up right in just under about 2 months or so, right? Just a little bit under 2 months. So yeah, I'm looking forward to that. That'll be hosted here in Santa Cruz at my office. And actually, since I see, I'll make a big announcement out of it. We already did that earlier, but we're going to have our DC of the Year award. We already had the awards and announced our DC of the Year, but I am looking forward to seeing the DC of the Year in person at that seminar, and that'll be in July, so that I can actually hand you the award and we'll be good to go. So that'll be a lot of fun. But anyways, it will be, yes, July 13th. So that was a good question. And let's see, I saw another hand go up, but I don't see that hand now. So let me see. Nope, don't see a hand up. If there is any questions, though, now would be the time. You can raise your hand. I'll be happy to answer any questions that you have. And aside from that, I appreciate you following through this process with me. Ultimately, our goal out of being a part of DC trainings and being following through the processes and the sequences within each one of these webinars is to better your services to your patients, to have a more successful practice, to increase your profits, to increase your team's satisfaction with their own work and with the results that you're providing for all of our communities out there, so they can live subluxation-free, optimum health lifestyle lives. Did I say that right? We want them to live subluxation-free and enjoy the highest quality of health in their lives for themselves and their families. So I thank you for being a part of this. I don't see any hands up for questions. So I will look forward to talking to you next week. And in the meantime, stay committed, push ahead, have fun, and enjoy the ride. And I'll talk to you then. Thanks again.
If you would like to become a member of DC Trainings, be sure to head on over to dctrainings.com to get started today.